Hello, hello. Welcome back, everybody. Welcome back to the podcast. Welcome back. We got another week of new episode on the CT Educator podcast. So if this is your first time listening to me, hi, my name is Karina. I am a registered CT technologist. I have 23 years of scanning experiences. I am experienced in all four of the main CT machines that are currently out there. So, and I teach awesome courses. I have two awesome coaching programs. I'm also a mom to two special needs kids, and I have an amazing boyfriend that is just my best friend, my partner, and I just adore him. So, hope you guys are having an awesome week. You know, summer is right around the corner. So, with summer, I know lots of people are getting ready to be, physically fit, get in those bikinis, those swim trunks, the whole nine yards. So, I want to give you a special thing or a special treat. I have an awesome online fitness coach, which happens to be my significant other, my partner, my boyfriend, who is an amazing coach and has cleaned up my form ever since I started the fitness journey that I've been on for the last year for the millionth time. And I look absolutely fucking phenomenal. He has cleaned up my form. We work out together. He is an amazing coach. So if you're looking to get summer ready, summer is 3 months away, guys. So if you're looking to get into the best shape of your life, he is the coach for you. There is a link to a client form so you can go ahead and chat through anything you want to chat through with him. He is also on TikTok if you want to see his gym content. He has a lot of good content on TikTok. So make sure you give him a follow and sign up for his coaching program. He is taking 10 clients at the moment. So make sure that you sign up. It is $500 for 12 weeks of coaching. There are payment plans. So this is a great investment, and it's a great investment to invest in yourself because the best investment you can do is invest in yourself, and your health and wellness is important. So get on his coaching, sign the client form, fill it out, and get some coaching from him. Okay. Also, let me kind of give you some rundown on some of the new stuff that I've got for the CT Educator. So, if you don't currently follow me on all social platforms, make sure you do. Everything is linked on the show notes. Okay. I have an awesome YouTube channel that I'm starting to incorporate a lot of YouTube lives and a lot of how to content. So, make sure you guys check that out. Okay. Also, I have introduced, if you didn't listen to the last podcast episode, I have a new coaching program. It is 16 weeks for technologists that are looking to transition into becoming a traveling CT tech. It is awesome. I give you a good roadmap on how to execute this and be successful so you can make a shit ton of money. Because, traveling assignments, we make more than being just a staff tech, okay? I'm even dabbling into a little bit of this to see, if I can just leave the staff job and take more traveling assignments as myself. I also teach on the side as well. So work from home is my dream life. So that is what I want to do, but I might just dabble into some, traveling myself. So because I have awesome friends that do travel and I've gotten a lot of good information as far as that I'm going to pass on to you. Okay. I get recruiters that contact me at least 5 or 6 times a day because of my work experience and the wealth of knowledge I have. This can be you. Let me say that again. This can be you, okay? Where you've got recruiters constantly sending you emails, text messages, calling, the whole fucking 9 yards. And on my YouTube channel, I'm going to have a dedicated video where I'm going to show you proof of possibility. So make sure you subscribe to the YouTube channel. I am taking 10 students for this program, 10 students only. So the registration link to get into this program is only going to be available for 7 days, for a week. So from starting today and a week from now, 7 days from now, that's how long you have to register and enroll in this program. So it's 10 students. We go through 16 weeks. I give you an entire roadmap on how to execute this. And I'm going to give you some ideas on some good traveling companies, some companies that have been recommended to me. So make sure you sign up for this program. It's $2,500. I have awesome payment plans, so don't freak out about the price, okay? The best investment you can make is in yourself. So get in on this program. 10 spots is all I have. So once those spots are filled, you got to wait till the next round. So get in on that program if you want to become a traveling CT tech. The only requirement is you have to have a year of experience in CT. Lots of these traveling companies require that. So you have to have at least a year before you can enroll in this program. Secondly, my OG program, the CT Educator, is getting a new name. It is the CT Blueprint Program. 6 months coaching in my program. I'm going to mentor you. This is for brand new CT technologists. CT technologists that have never worked in CT, transitioning from X-ray to CT, need to learn CT. This program is for you. This is 6 months. I get you up to speed to be the go-to CT tech. Okay. We all know it's bullshit that 6 weeks of training does not get you the basics and you do not know everything that there is to know about CT. So 10 spots is only available in this program as well. So it's 6 months. You get to coach, mentor. We do weekly classes where we go over. I will go ahead and review the gaps in your training and where you need to be in the next 90 days each. So we're going to set up 2 goals every 90 days on what you need to accomplish. Okay. And then I'm going to do weekly check-ins and assess your progress. So if this is you, that you need help, you're brand new, there is a registration link in the show notes. Make sure you enroll in the program. It is a $5,000 investment. Okay. I know people freak out about prices. I have awesome payment plans. You can use Affirm, Klarna, Afterpay, whatever. And I have a regular payment plan every single month as well. So make sure you get in on the program, okay? The best investment you can do is in yourself. So don't let the price scare you. So it's 6 months of coaching. So I have 10 spots. Once the 10 spots are filled, that's it. And you got to wait till the next round, okay? Everything that I talked about is in the show notes. So come get summer ready. You're ready to transition to traveling. Come into my program. You're ready to transition from X-ray to CT, get in on that program, okay? All right, let's move on and let's get into today's episode because I'm so excited to talk about the topic I'm going to talk about today. So we're going to be talking about CT emergencies and what to do when things go wrong and the shit hits the fan, okay? Now, in CT, we have a lot of different situations that do happen. We have patients who have contrast reactions. There are contrast infiltrations, extravasations. There are equipment failures when your scanner stops working, your computer freezes. And we also have situations where we have a lot of complicated cases. So we're going to dive into each one of these. So we're going to start out with talking about contrast reactions and extravasations, or i.e. infiltrations. Okay. So a lot of times we have patients who have probably never had contrast or have a high list of allergies that they've been pre-medicated. And I want to stress the whole thing surrounding pre-medications. Okay, sorry, I took a pause there. Now, when patients are pre-medicated, it is to minimize the reaction to contrast. It does not take away the whole contrast reaction as a whole. It's to minimize the symptoms and the types of things that they would feel if they were having a contrast reaction. I know a lot of physicians love to tell patients, oh, well, once you get pre-medicated, you won't have a reaction. Fucking bullshit, and it's not true. It just minimizes the symptoms of the reaction. Trust me when I say patients do have contrast reactions, even if they're pre-medicated. It happens all the time. So physicians need to be very careful in their wording as far as telling patients that you won't have a contrast reaction if you're pre-medicated, because that is wrong and it's bullshit. Plain and simple. Okay. So when we see contrast reactions, it's usually patients who probably have never had contrast before, which is a very, 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 very small percentage. It doesn't happen very often. Usually, patients who have contrast reactions is because they've had contrast in the past before, they have a long list of allergies, and then all of a sudden their body reacts to contrast. So, usually, those are the typical populations that we see. Okay. Or if they've been pre-medicated, and yeah, they can still have a reaction to contrast. Okay. So what do we do in the event of those instances? So when it comes to that, to assess the patient to see what they're feeling, if there's any changes as far as any rashes, any hives, anything that they're feeling post contrast injection. Now, if they start to feel any tightness, any like in their chest, in their throat, they feel like it's closing, they're getting short of breath, they start itching a lot, that's when you need to activate your rapid response team. Or if you don't have a rapid response team, which most hospitals and facilities do, with the exception of outpatient, usually you would have to call 911. Then you would get the rapid response team to assess the patient. Typically, we do have a reaction box in CT where we give medications to reverse the symptoms of the reaction. Okay. So in that instance, we make sure that the patient stays calm so they can be assessed properly and medications are given to counteract the reaction. Okay. So usually minimal reactions is usually like if the patient starts itching, if they start coughing, vomiting is a very, very mild reaction. I know some patients get nauseous when it comes to contrast media. But the ones we want to look out for are the serious ones, like the hives, the swelling, the tightness in the chest, the tightness in the throat. If, they have swelling around the lips. I remember there was a lady who was pre-medicated, highly allergic to contrast, but they still wanted to proceed with the freaking exam, which a VQ scan would probably be a better alternative, because she said every time she gets contrast, her lips swell and she swells up like a balloon. And she's been pre-medicated every single time. And we try to stress to the doctor, listen, the reaction can be worse next time. Nope, they wanted to go ahead. So we make sure our documentation was in place. So when we contrasted the patient did not have a PE, which a VQ scan probably would have been more appropriate considering that she breaks out every single time she gets pre-medicated. Well, her reaction was a lot worse. Like her eyes swelled up so bad, the patient could not see. And her throat, she says, was closing so fast that she was having a hard time breathing. So, of course, we activate the rapid response team, and the same physician who wanted to go ahead and, have us proceed, it says, well, maybe we should have gotten that VQ scan. Go figure that. Okay. After we try, because we have a code of ethics. It's not that we're trying to be difficult, because I know some physicians are going to listen to my podcast. It's not technologists being difficult. It's technologists making sure that the patient is safe and making sure that nothing happens to the patient. But when you push an exam, knowing that that you're pushing the boundary of, the patient being in danger, that kind of crosses the ethics line of, was this the right decision or it wasn't, right? So the patient had like a serious reaction. And from that point on, they had instructed her not to get contrast ever again. Okay. Because the next time she'll probably need anesthesia, like right there, because ready to intubate her. Like contrast reactions are very serious. And I don't think that physicians think that it's not a serious thing. And it really is until you're really there and the patient is like their life is in your hands. Okay. So I can't tell you the last time I did chest compressions on somebody who had a contrast reaction. Luckily, we got them back. Okay. So make sure that you are aware of what to look for and how to activate help so you know what to do. Now, when it comes to infiltrations, extravasations, that is a different avenue. Now, typically infiltrations do happen because the IV goes ahead and gets displaced out of the vein and is into the skin or the muscle of the patient's arm. So 9 times out of 10 that happens is the patient, we like antecubital IVs, and the patient's moving up and down, with their arm, and it can displace that IV. A lot of times is if it's placed incorrectly. Okay. So what I always encourage and recommend and require every technologist that trains under me is to make sure you check your IVs properly. Now, there are certain IVs that aren't going to get a venous return, but make sure it's flowing in that vein and not bubbling underneath the skin. Okay. That's always what I do. So I always encourage and require people to do that 10 cc hand flush and flush it as hard as you can. I also require techs to make sure that they power inject 20 cc's of saline to make sure that IV is patent. Make sure that IV can hold that injection, because I see a lot of techs that, alter their injection flow rates. You need to keep your saline the same rate of your contrast injection, okay? Because you have to make sure that IV works well, and you have to maintain contrast enhancement as soon as, you run out of contrast and you're still scanning, right? So usually the infiltrations that I see is because lines are not placed correctly. Okay. And this is not placed correctly. They haven't been checked in a while. And I know this is going to trigger some nurses that may listen to this podcast, but the reason why we require, ACs is because contrast is very viscous. Contrast is dangerous, and contrast can cause a patient to lose their limb with compartmental syndrome. Okay. So, and those are the things that we're trying to avoid. Now, contrast infiltrations, they do happen. So, how do you manage that in the event that you do get one? If you see contrast infiltrating and you're able to stop the injection, do that. Okay. And then assess the patient. Well, let's just say it happened in the middle of the scan somewhere, hypothetically. Okay. Because that tends to happen a lot. So if that happens, what you can do is assess the patient's arm, remove the IV immediately, okay, and alternate between a warm and a cold compress, because there's no hardcore evidence to say that one is better than the other. So radiologists like us to alternate with both. So to, put the cold compress, to keep the swelling down, and the warm compress to kind of, minimize, get all that contrast, to kind of dissipate, right? So in the event that you do see that, make sure you document, make sure you let the nursing know, and make sure that you remove your IV and cold and warm compress, alternating for the patient. Okay. So the next thing that we're going to talk about is, sorry, my child is wanting to do her iPad. So the next thing we're going to talk about is equipment failures. Hold on, sorry. Okay, so the next thing we're going to talk about, which is super, super duper important when it comes to emergencies and how to handle them, okay, is equipment failures. So equipment failures is when your scanner fails in the middle of a scan. Let's say, for example, your computer freezes, you get detector artifacts, you get, no localizer, you get tube failure, anything of that sort. This is where you can go ahead, and I'm going to give you some tips on how to kind of correct them. And if need be, you need to call biomed. Okay. So typical like equipment failures. So let's say the injector's not working. So the scanner's not working. Usually what I recommend, because these are things that are like a computer at home. So you have to like restart them and turn them off for a period of time, and then reboot them. And usually that'll clear up whatever error there is that's going on that scanner. Okay. Now, I had an instance where I was doing a TAVR study on a patient the other day, and the computer completely froze. So I had to take the scanner completely down, which this scanner that we have, it takes like 15, 20 minutes for it to reboot. So usually if you get a lot of computer freezes, it's because there hasn't been a restart on that system probably in quite some time. So I always recommend when you're doing your QA, make sure that, they're shutting down the machines somewhere in night shift, for like a couple of minutes before they reboot them, especially if you have more than one scanner at your site. The site that I work at, we have 5. So it's no difference if we take one down, each individually. So usually that's what happens, and you have to reboot the scanner, and it usually will clear up a lot of errors. Okay. Now, detector artifacts. This is when you start to get rings around your images or some kind of streaking or something. That means one of the detectors is going out, and Biomed has to be aware of it so service can come out and fix that problem. Okay. So a lot of times, or if your tube goes out, that means you can't even localize your scan. So then you would have to call Biomed. We just had that happen, I think today. I was reading the email from work because I have to work tomorrow, and I always have to get up to speed if I need to know anything before I walk in the door in the morning. So, because I typically do not check my email when I am off, but I usually check it the day before just to make sure that I'm prepped and ready to go before I enter the hospital. And apparently, our 256, which is the scanner that does all of our traumas, they do all of our cardiac scanning, all of our peds, when they can't move, when they can't hold still, excuse me, went down because of tube burnout. I work at a trauma hospital, so these scanners are at high capacity use and they work like crazy. So, in the instance of tube failure, that's where my Biomed and then the vendor has to come out and replace that x-ray tube. And that tends to happen when you work at a facility that's high capacity and you're pumping out scans. I mean, the ER doctors are ordering CTs like it's nobody business, because who needs a fucking physical exam anymore when you got CT to do it for you, right? So I should put that on a shirt. So in those instances of equipment failure, there are ways to correct it with the common things like computer freezing and just rebooting things to see. Sometimes, an air cow will clear up some kind of artifact on your image, or you have to call service in case your tube goes out or detectors, you start to see rings in your scan. That means the detector is failing. Okay. And the last thing I'm going to talk about in this episode is complicated cases. So, when I talk about complicated cases, we're talking about trauma cases. We're talking about patients who may be developmentally delayed or special needs, contracted patients, and combative patients. How do we handle these situations? Now, when it comes to trauma, we are very careful and cautious, and we try not to disrupt any fractures or anything that is out of place. And we try to make sure that we scan the patient efficiently and get them out of there. Because a lot of times they are not stable. Okay. So what's good is to work with, whoever the nurse is or the doctor and say, hey, can we manipulate this so it doesn't hit the scanner and do that? And what I always do is have them move the body part. Like if I say, hey, this is going to bump the scanner, I really need to get it in the field of view, and I will have them move it so I don't disrupt anything. Now, when it comes to patients who are developmentally delayed, special needs patients, which I have a lot of knowledge because I am a special needs mom to 2 kids who are special needs, extra care has to be taken. So usually what I do is, even though most of the nurses in the hospital know that I do have special needs children, and when it comes to patients like that, if I'm working, they tend to specifically ask for me. So because I've had a couple of nurses that have done that. And usually some of the techs, all the techs in my department know that I'm a special needs parent. And when it comes to kids like that, or even adults, they ask for my assistance on what they can do to execute the scan. So usually with those, I tend to make sure that whoever the caregiver is to come with the patient. So, because that is very helpful, because they know them, they can calm them down, they can keep them calm. And sometimes I even have them stay in the room, give them some lead, because the patients who are getting scanned are more comfortable that way. So, Always, always, always collaborate with whoever the caregiver is, whether it's the parents, whether it's like a caregiver from a facility, if the patients come from a facility, whatever the case may be. It's always good to collaborate and just ask questions on how we can better serve the patient. Okay. Now, when it comes to contracted patients, I know I stress a lot about centering. Even on contracted patients, you could still center properly, but of course, you're going to get distorted images. It's because they're contracted. These patients have been ill for a very long time. They come from a lot of nursing homes and rehabs. So we do the best we can. You can still set them up properly, even though they're contracted. You could still execute a quality exam. And of course, it's not going to be perfect. Okay. On patients like that, they're not going to be perfect, but you could still center them and give them the correct amount of dose. Now, lastly, when it comes to combative patients, my recommendation is if the patient is calm and unless they're not suspecting some kind of head injury and they can sedate them, that is the best option possible. Okay. Please do not hurt yourself fighting with some patient and trying to hold them down. Now, some of them, they may seem combative, but they may be cooperative, by immobilizing them with patient restraints and using some Coban around the head. I could tell you a story where I worked with a tech who used duct tape. I know that's a big no-no, but we used to scan a lot of drunk patients that would fail to hold still, and they would break out of the Coban. So he got mad and brought in some duct tape and would cut them out of it. So, hey, you got to do what you got to do, right? There is no judgment here. So when it comes to combative patients, use all the immobilization tools available to you. I know we have pads to keep the head straight so the patient doesn't move back and forth in the head holder, which I always recommend with combative patients. If you're going to do a head CT, use your head holder. Don't try to put them on a pillow because they're just going to move all over the place, okay? And always, try to make them comfortable, immobilization straps, whatever we can. If there is a possibility where physicians can sedate them, that is usually the best option possible. And just do the best you can because some exams on combative patients are not going to be optimal. Okay. So that is the episode for today. That is all I have for you, you guys. So I hope this episode was insightful. Make sure you share, subscribe, like the podcast. So because I give you all the educational stuff and even more on this podcast. So make sure you check out my coaching programs. Want to get summer ready? Sign up for my boyfriend's coaching program. He is an awesome coach and he will get you summer ready in the next 90 days. So thank you so much for joining me in this episode, and I will chat with you guys in the next episode.